Severe depression and OCD can feel like a mind trapped in a closed loop. The same intrusive thoughts and the same emotional numbness repeat over and over, with no clear exit. If we look at this diagram under the fragmented care section, we see how traditional medicine often responds. Therapy, medication, and brain stimulation are treated as completely separate blocks, disconnected from one another. This leaves the exhausted, vulnerable patient to do the heavy lifting. They have to carry messages between different doctors and try to stitch together their own recovery from pieces that don't naturally fit. But look at the coordinated care side. This is the TMS Plus framework. Biological, psychological, and physical interventions are synchronized and locked together under one unified timeline. True recovery requires a clinical system that actively carries the burden of coordination for you, rather than leaving you to navigate a broken puzzle alone. The process begins with a referral from your doctor or hospital. Soon after, a dedicated TMS coordinator contacts you directly to explain the program, answer practical questions, and map out the financial steps. Next, you undergo a detailed psychiatric assessment. The clinical team maps out your specific symptoms, your treatment history, and the exact patterns of how you experience intrusive thoughts or emotional blockages. Because every brain is different, treatment isn't a one-size-fits-all script. Your care is organized into a personalized pathway tailored exactly to your clinical needs. This document outlines the structured steps of the patient journey, from assessment into specific treatment plans. Depending on your situation, you might enter an accelerated pathway for concentrated treatment, a signature pathway for deep immersion, or a modular pathway that evolves responsively over time. By laying out these exact steps from day one, the terrifying unknown of psychiatric intervention becomes a clear, predictable map where you are fully supported at every stage. When you arrive at the clinic, you enter a coordinated ecosystem. As shown in the top row of this system overview, your care is managed continuously by a multidisciplinary team of psychiatrists, psychologists, nurses, and TMS technicians. The first clinical action is acquiring a purpose-built brain MRI. The software generates a specific 3D model of your neural circuits, pinpointing the target in the cortex. Stereoscopic systems then use this map to guide the magnetic coil, ensuring absolute precision. This biological mapping ensures that your treatment is never based on guesswork or averages. It is uniquely tailored to the physical reality of your own brain. With the map complete, your precision transcranial magnetic stimulation, or TMS, sessions begin. This daily stimulation serves as the biological foundation for the rest of your program. Targeted magnetic pulses return neural networks to a healthy baseline. This reset induces neuroplasticity, making the brain highly receptive to new learning and habit changes. TMS is the critical therapeutic spine that physically enables subsequent psychological therapies to take root and actually hold. Looking at the clinical pathway timeline, we see that once the biological foundation is set in Phase 1, immersive psychological therapies are introduced carefully and progressively in Phase 2, ensuring you are never overwhelmed. Depending on your diagnosis, these therapies involve specific psychological tools. For depression, we use AI-guided behavioral and emotional activation, and for OCD, structured exposure and response prevention. To augment these therapies, we introduce immersive hardware. A patient wears a VR headset paired with a targeted scent device positioned below the nose. The sense of smell has a unique architecture. Controlled scents bypass the brain's analytical center, the thalamus, to directly and immediately anchor the nervous system. Clinically, this sensory bypass forces a rapid shift. It pulls you out of anxious, amygdala-driven overthinking and grounds you in a state of direct, physical feeling and calm observation. Layering this sensory immersion over a biologically primed brain allows you to actively process distress and build tolerance in real time, rather than just talking about your symptoms in a chair. You transform from a passive, overwhelmed patient into an active, engaged participant within a structured therapeutic environment. Throughout this process, digital coordination platforms capture real-time data from every session. This allows your clinical team to continuously monitor your progress, remotely oversee your care, and safely adjust the pacing of your treatment. As the intensive phases of your treatment conclude, You receive personalized reinforcement materials drawn from your actual sessions, including custom AI-generated mindfulness tools and therapeutic audio scripts. You leave the clinic with a biological reset and a personalized, data-backed toolkit to maintain your resilience at home. This circular puzzle represents the core identity of TMS Plus, a coordinated, immersive interventional psychiatry framework that locks biology, technology, and multidisciplinary therapy into a single unified whole. This system provides true continuity of care, bridging the gap between intensive targeted treatment courses and the daily realities of your life. The ultimate goal is to reawaken emotional access, dismantle the architecture of intrusive thoughts, and restore your ability to function and thrive. True psychiatric recovery is possible when we combine precision biology, immersive psychology, and human compassion into one